The coronavirus has hit the UK.
Department of Health has announced in the last half hour that 14 more people across Britain have died.
The main symptoms of coronavirus to look out for are a continuous dry cough and or a fever.
You must stay at home.
A lot of us have had to adapt to the new way of living, and it has been tough. But for people like Lauren, who suffer from disordered eating and depend on the gym to cope, this lifestyle change has been detrimental.
People can say, like, do home workouts, it's the same, but it's not. It's the atmosphere of the gym. It's knowing, like, you go there and you're taking care of yourself, not only physically, but, like, mentally as well. So if I felt like, say, one of my unhealthy eating habits or coping mechanisms, we'll call it, is to, like, binge or eat unhealthy stuff, even if I don't feel like it. So if I felt like that, I could easily just go to the gym. Whereas, see, if I was to do a home workout in the house, it's not the same because I'm still around everything.
An eating disorder charity, Beat, reported an 173% increase in demand for support between February 2020 and January 2021. The Bridge, a treatment centre here in Manchester, have also witnessed a surge in referrals since the start of the pandemic.
Eating disorders, in my experience, are, coping mechanisms for underlying emotional distress. And God, what more of a time to have underlying emotional distress than being in a global pandemic? People's lives have changed exponentially throughout this pandemic, and really noticing that they're kind of using food to cope with that, hence them coming to us and wanting support.
Ferne was made aware that lockdown must have been very difficult on those who have previously suffered from disordered eating.
Ex-clients who I'd kind of finished working with, and we kind of completed that work maybe like last year, getting back in touch again, and kind of saying, I feel like I could really use the support again, almost like being afraid of, I guess, like relapses really. So I've kind of also been aware of ex-clients coming back again and wanting some support through the pandemic.
Services such as the Bridge are there for those who are struggling, but there are other ways people cope too. Lauren found self-help books and self-development the way forward during this pandemic.
Like, the NHS is there to support you and stuff, but it is a lot of, for me, like, the independent research and the work. I'm quite lucky to have the support I have around me, like with my family and stuff, but I'd say it's definitely been mostly like independent, like from self-help workbooks and things like that. It's helped me throughout lockdown.